welcome to Day 5 of Premi Power Week. I'm Fabiana Bacchini, Executive Director of the Canadian Premature Babies Foundation, CPBF, and your host for this event. The Premi Power Week is the second of two international live series that CPBF is hosting 2020 in recognition of World Prematurity Day. These educational sessions are in collaboration with the International Family Integrated Care Committee, the Canadian Association of Neonatal Nurses, EFCNI, and GLANCE, the Global Alliance for the Newborn Care. For those not familiar with CPBF, we are a charitable organization, and our mission is to support and educate Canadian families of premature babies every step of the way. We believe that through consistent information, access to helpful resources, and peer support inside and outside the NICU, we can empower families, ensuring they are ready to care for their baby. Consistent information is especially important today when we are facing a global pandemic. With educational sessions like this, we intend to bring you the guidance of healthcare professionals and the knowledge gathered by researchers around the world. These are valuable tools to help our community raise awareness and advocate for the well-being of families and their babies. And I would like to thank AbbVie for the unrestricted educational grant and Pampers for supporting the Premi Power Week. And right now, we're going to start this day talking about sustaining essential care, preterm newborn challenges within the COVID-19 pandemic. The World Health Organization's Sustainable Development Goal 3.2 establishes ending preventable death of newborn and children under the age of 5, with all countries aiming to reduce neonatal mortality and under 5 mortality by 2030. Preventing preterm birth along the life course through preconception and antenatal care is essential, but also providing adequate care and follow-up to those babies born prematurely, sick, or with other adverse conditions. As the world addresses the COVID-19 pandemic, we must safeguard decades of progress on maternal and child health and well-being. The continuity of essential services and funding for reproductive, maternal, newborn, child, and adolescent health must not only be protected from cuts or reallocation as part of national COVID-19 response and recovery efforts, but also prioritized and increased to respond to the immediate and long-term repercussions of the pandemic. And I have here joining me live from Uruguay, Dr. Duran, Dr. Pablo Duran, who is the Regional Advisor on Perinatal Health at the Latin America Center for Perinatology, Pan American Health Organization for the World Health Organization. Dr. Duran is an Associate Professor from the Department of Public Health, University of Buenos Aires. He has more than 25 years of clinical experience as a researcher and expert in epidemiology, monitoring and evaluation of policies and population interventions in maternal, newborn, and child health. He has obtained 4 training scholarships in Argentina and abroad. He has received several awards for his scientific work. He has authored more than 50 scientific papers in peer-reviewed journals, and he's the author of more than 15 books and contributor to technical and publication books on pediatric, nutrition, epidemiology, and public health. Dr. Duran, thank you so much for joining us here today. What a pleasure to have you sharing your life experience, your expertise and knowledge. Welcome. You are mute. Maybe you can unmute yourself. Great. Thank you, Dr. Duran.
Thank you very much.
We are so happy to have you. You can share your screen with us.
Yeah.
Dr. Duran has a presentation, and then at the end of his presentation, you're going to have a few minutes for Q&A, and you can send your comments or your questions on the box below the screen.
Can you see the presentation?
Absolutely.
Okay. Again, thank you very much. Good morning, good afternoon, and thank you to CPBF, to Fabiana Bacchini, and to all of you. I'm really happy and grateful for sharing with you these thoughts about the sustaining essential care for very small and preterm newborns. We are as it was mentioned, facing perhaps the most serious challenge that we as human beings should face during the last years. But still, providing care to newborns, and especially to preterm and sick newborns, continue to be a challenge. So it is really my pleasure to share with you, mainly to those of you who are committed to providing care as parents, families, and community. And I would like to start thinking with you about the life expectancy. During more than 25 years, the life expectancy has grown in our region. The last data from 2017, we can see that the life expectancy is for North America around 80 years, with a shorter life expectancy in the region of the Americas and in Latin America and the Caribbean. But the question is if living longer means living healthier. And the issue is that the time around birth, we know that is the most important time in our life. And we know that the time around the delivery and the first date of life is the most challenging period of time where we can be happy enjoying our babies, but also where we need to provide the adequate care to reduce the risk and the impact. And even when the neonatal mortality and stillbirth has been reduced in the region during the last year, the second condition that we need to consider is if that reduction has or has not been with equity. And we can see in most of the countries in Latin America and the Caribbean, and you can see there on the picture on the left, the gap between the red and the yellow circle express the gap between socioeconomic conditions at households and the risk of adverse outcomes at birth. And we can see that the gap in most of the countries, it's important. So it means that those newborns at poorer households are exposed to higher risk to presenting adverse outcomes. And even when along the time this gap has been reduced, it is still being a challenge to reduce these gaps in the countries in the region, but also within the countries. Socioeconomic conditions, living in rural areas, ethnicity, and other conditions that we all know are affecting babies at the time of birth. On the graph on the right, you can see that the same perspective can be seen in terms of accessing specific interventions. Again, we can see that there are important gaps in accessing family planning, prenatal care, accessibility to 4 or more prenatal cares, or delivering with skilled birth attendants. So mothers and family are exposed to inequity in terms of the quality of interventions that we know are important to reducing the impacts. And now we are moving to prematurity, and we can see that again, the risk, the probability of having a preterm baby depends on the socioeconomic conditions. We can see at the global level that between 7.5 or 12.5 is the difference in terms of the prevalence, the proportion of preterm babies between the more developed or the less developed countries. This is the same in Latin America and the Caribbean and North America, but we can see in a different way. While in the Caribbean, the proportion of preterm babies is 6.7%, in North America, it's 10.6%. So we need to think, why are these conditions? Why babies are being born prematurely? But also to think which are the risks associated to these conditions. And we know that maternal and perinatal health, inequity, and disabilities are closely associated. You can see the red bars. The red bars, the hard red bar means the maternal and neonatal conditions and nutritional deficiencies that can contribute to disability. We can see the bar on the right that correspond to the low socio-demographic index countries, that in those countries, the contribution of maternal and neonatal conditions that are responsible for disabilities are higher. So if the maternal and neonatal conditions are inadequate at birth, and mainly in populations with low socioeconomic conditions or with low socio-demographic index, they are highly exposed to different disabilities. So the high prevalence of prematurity and inequity are great contributors to inadequate health conditions, growth, and mainly to disabilities that will affect along the life course this baby, his life, his family, and at the end, reducing or increasing the loss of human capital. We can see that as an average, the proportion of prematurity in Latin America and the Caribbean, we said it's around 8 or 9%. We can see on the pyramid on the right that even when at the global level 120 million babies are born at the adequate gestational age at term, we can account for more than 12 million babies that are born between 32nd and 37 weeks of gestation, 1.6 million that are moderate prematures, and around 1 million who are extremely premature babies. These babies are, or these conditions, this prematurity is associated with the presence of moderate or severe long-term disability. So we are talking, when we see regional numbers, when we see what happens in the region of the Americas, that every year 15 million babies are born. From them, more than 140,000 will die before the first month of life. But also, more than 1.2 million of premature babies are being born every year, and this is an enormous number. And from them, just as an example, we can estimate that more than 30,000, and these numbers are every year, so every year 30,000 newborns will probably present moderate or severe complications linked to this prematurity. And for example, around 25,000 newborn will probably present retinopathy of prematurity that will lead to blindness or affection of the vision. So we are talking about serious complications, but this is not all bad. Adequate care based on the needs of every newborn can contribute to reducing the impact on human capital. So we have good news. we have the evidence, and you can see here 2 technical documents just as an example. The one on the right from the World Health Organization, and the one in the middle, the green one, that we are launching in few weeks in Spanish, but I make the promise that this will be available in English by December, providing clinical guidelines to providing adequate and evidence-based care and follow-up to preterm, small, and sick newborns. And why is important? Because if we implement all these interventions, we will not only, which is not less important, to reduce all these disabilities that I have mentioned rapidly. We know that also implementing those interventions from the prenatal and perinatal period will be able by the year 2030 to reduce around 20,000 stillbirths, around 45,000 neonatal deaths, and more than 50,000 infant deaths. So we're talking about large, really large numbers, and it's not only important about the large numbers. I know that it's important, but it's also important every newborn, every family who has a baby, a premature baby, that received all the care, all the information, and all the interventions that are adequate to prevent these conditions. And how do we need to move in order to address these results and to provide this comprehensive care? The main approach that I would like to highlight is what we call the Lifecourse approach. We know that at every stage in our life, there are interventions that need to be implemented and that will have potential and positive impact along the life course. We are talking about preconception, prenatal, delivery, early postnatal, childhood, infancy, youthhood. So we need to identify the link and all the intervention that has to be implemented that involve from family planning and preconception nutrition, because we know that it's important to prevent and reduce infections, nutritional deficiencies that are linked to birth defects, to prematurity, and to other adverse conditions. We also need that routine antenatal care and antenatal nutrition, prevention and diagnosis and treatment of specific infections that are highly prevalent, as for example syphilis or other infections, are still affecting newborns all around the world, and mainly in Latin America and the Caribbean. And the assessment and management of fetal health and growth, and also maternal complications during pregnancy, at the time of labor and birth. And these interventions will prevent having a preterm baby. So it's really important to promote preconception, prenatal, and perinatal care in order to prevent prematurity. But when prematurity occurs, we also have evidence and technology and knowledge in order to prevent the consequences and the complications associated with prematurity. This is talking about the prevention of specific disease, provided adequate nutrition and care that needs to be continuously supported along the coming years, the childhood and school age. I'm sure that you know about this, but the human brain development, it's not only in one period. It's not that the baby is born with all the brain and all his functions developed. The different pathways, the sensory, language, or higher cognitive functions are developed from conception up to depending on the function, up to the childhood or adolescent. And providing the adequate care, nutrition, and when I'm talking about care, it's not only medical care or nurse care, it's also love, it's also care, it's also being born and being cared within a family context. The caregivers provided love and adequate care will contribute on improving what you see on the graph on the right. The brain in the newborn needs to continue developing the complexity, the neurons connections that continue mainly up to the 24 months of age. And to contribute on that growth and development, we need to provide adequate environments. During pregnancy, the mother provides this environment, and we need to care this environment, which is the mother, and it means the nutrition, the mental health. We know that violence in the household is an example of a condition that can also affect the baby's growth and the presence of prematurity, and also the environment once the baby is born in the household, receiving adequate health, nutrition, and investing in early childhood in the period of time that we are talking about. It's not only about medical care, as I said, or nurse care. It does not only related to technology, NICUs, etc. We know that investing in early childhood contributes to social and economic development from the rights perspective, because we know that the Convention of the Right of the Child states that the states, the countries, and the society needs to recognize the right of the child to the enjoyment of the highest attainable standard of health and the child's right to development. But also it's related to equity, because every newborn, every child has to receive the same quality of care. But it's also related about economic, and we know that investing in early childhood is cost effective. For example, $1 invested during early childhood has the return of 13 times that can be seen or measured in terms of educability, income, and development along the life course. And the last issue that sustain this important is the impact of the conditions along the life course that we have already mentioned. So within this framework, from the global and international perspective, there are several strategies and approaches as the nurturing care approach that promote these main three objectives, which are survive. We have the commitments, countries have the commitments of achieving ending preventable deaths, maternal, stillbirth, and newborn deaths. Thrive, what means ensuring health and well-being for mothers and newborns, and transforming the environments, expanding, enabling environments. What does not only mean the microenvironment, the family environment, it means the social environment, the physical environment, all the conditions that can contribute positively or negatively to the health and well-being. So the Pan American Health Organization Common Agenda highlights these main issues: promoting health as a main strategy, ensuring appropriate and timely quality health services, but also providing priority to care to vulnerable children and families, including in emergency situations. And at the end, providing a legal instrument to build an integrated system that provides care. Care understood as the nurturing care approach that you can see here, which involves not only medical, physical care, it involves adequate nutrition, it involves responsive caregiving, it involves security and safety, opportunities for early learning, specific for every step in the process of growing and developing, and good health. This comprehensive approach then involves different stakeholders and different actors. It's not only responsibility of the families, it's not only responsibility of the health system. It involves obviously the caregivers as the primary providers of care, but also empower communities. It's not only an individual action, it involves the communities as a whole, and also supportive services. And what services? It's not only about health services, it's social services, it's educational service, it's all the care that is provided by society as an organized society. And finally, enabling policies, legal regulations that make that these interventions are made reality. So which are the specific stakeholders? All who are part of the society, the multilateral and bilateral organizations, the governments, but also the business community, also the academic and the research institutions, also the philanthropic organizations, the civil society, parents organizations, media, that will advocate and work on promoting safe and positive agriculture, nutrition, labor regulations, finance, health, environmental health, child protection, education, and social protection. So it's a complex network where every person has a role to play. Just as an example, this is an analysis that we have performed around the availability at the countries in Latin America and the Caribbean related to national policies for preventing retinopathy of prematurity, having national guidelines, national legislation, or national data collection and monitoring system. And you can see that each bar, each color of the bars represent one out of these four tools. And you can see that even when some countries have the four, the national policy, the national guideline, the national legislation, and the monitoring system, many countries do not have these four basic tools to promote well-being, to prevent and to treat retinopathy of prematurity. That I'm going back to the beginning, we know that around 25,000 newborns are exposed to this condition. So we need the national commitment, but also the families, the researchers, the health professional, the whole society involved in terms of addressing these issues. And I'm moving to the issue of the potential impact and the situation that this pandemic has put in our society, our region, and the world in terms of the potential impact. And from the very beginning, the main issues of concern related to perinatal health and the COVID-19 has been the prenatal and delivery care. At the very beginning, the question was, is there a possibility of vertical transmission of COVID-19 from the mother to the newborn? The immediate newborn care, because again, at the very beginning, the newborns and mother were separated because being concerned about the possibility of transmitting the virus and the possibility of affecting the newborn. The evidence by now does not show the possibility of vertical transmission from the mother to the baby, but also to sustain the specific requirements and risk for caring newborns, specifically preterm and sick newborn, and also the care at the time of discharge. And sustaining essential services for every newborn has been, as I said, a main concern, and we have been working, and we are still working, and it's necessary to provide at every level, at the national level and in every health service and community, sustaining evidence-based interventions. And which are those interventions? Providing immediate newborn care, providing postnatal care depending on the conditions and the risk of the newborns, and specifically in preterm or serious ill newborns, we need to sustain the adequate care to provide and to cover the requirements and admission to NICU when it's necessary, and providing safe care in transport and referral of this newborn, because we know that in many countries or in many cities or regions, the health system should readapt the response and refer some human resources to other services. So sustaining the provision of adequate care and specifically sustaining essential interventions. And I would like to stress again, sustaining breastfeeding as one of the most powerful interventions is important within this context. Also providing and strengthening immunization and preventing specific complications. We have learned during this almost a year within this pandemic that you can see these bars that express the proportion of countries that have reported having some severe disruption in specific intervention. And around 50% of the countries have reported disruption of family planning services, antenatal care, postnatal care, specific interventions for preterm newborns. So we need to stress sustaining essential care and reducing the disruption of care and services to these newborns. Essential services maintenance implies prioritizing essential services, and within these essential services, we need to highlight the need of sustaining the care for mothers in order to prevent preterm birth and also prematurity birth newborns in order to provide the adequate and required care. Also optimizing the configuration and service delivery platforms, looking for alternative options like community services, telemedicine, etc. Establishing effective patient flow at all levels within the same health facility, but also between health facilities and referral, rapidly distribution of health workforce capacity, and maintaining the confidence of the population. And this is, I think, the most important message in this forum, because it's important to support families and to promote sustaining the care for mothers and newborn in order not to expose and increase the prevalence of prematurity and the complications. Because the concerns are beyond the health services. We know that the impact on poverty levels due to this pandemic, it's real. We are expecting the increase in poverty level in most of our communities. The crisis aggravation of the situation that in most countries and mainly in displaced community, it's a real concern. Also the threats to survival and children's health and the risk for children's safety. And here I would like to include the issue of mental health and household in violence within the household, violence against the mother, the women, and the children. So this implies prioritizing the continuity of child and family-centered services with special focus on equity of access, establishing specific care for vulnerable families and vulnerable children. And again, preterm babies are within this condition, providing practical support to parents and caregivers, developing flyers, information, education materials, even texting through networks, social networks, in order to promote the adequate care and to provide adequate support. And this is an essential contribution of parents and family organization, and the value it's absolutely high in order to contribute to this process, responding to the COVID pandemic and reducing the impact. As I said, it's not only responsibility of the national authorities, it's not only responsibility of the healthcare providers, it's also responsibility of the social networks, social organizations, and parents organizations. So, and these are my final remarks. We are living in the region with high inequity, and more inequity will be seen in the coming years. We need to be aware of the key time, the time of opportunity, and the actors involved in preventing and providing adequate care, to preventing preterm birth and to providing the adequate care. We need to move from the institutional structure and fragmented interventions to a comprehensive interventions within the nurturing care approach that I have mentioned. We need to strengthen the equity lenses, because we are talking about the silent period. The preterm baby, we know that the risk and the possibilities of providing healthy growth and development will depend on our responsibility, and it's the responsibility of all of us, and each one has a role to play. So let's make that every baby count, and thank you for your attention.
Dr. Duran, thank you so much for your presentation, for giving us this big picture and the situation in the Americas. It's so very important, especially during this time. We talk so much about collaboration with healthcare professionals, societies, parents. But here we, as far as we know, in all parent organizations around the world, that NICUs have been shut down to parents in a lot of countries. Here in Canada, we had just new policies of one parent at a time, and just now a lot of units reopened for both parents. And we know through research how babies' outcomes can improve if both parents are present, because there is more kangaroo care, more breastfeeding, less ROP. How we are going to move forward with family-centered care as a simple intervention for better outcomes for babies?
Yes, I think it's a great challenge, and it has to be addressed at a different level. It's important to work at the parents and families level, promoting and establishing networks. It's important to raise the voice with the responsible for the health facilities, but also it's important to reach the authorities and those responsible for policy making, showing the evidence, because the evidence is available. Many times the head of the health, the NICUs and the health facilities are not willing of having the parents around, but we know that, and we have learned that having the parents would be also a support for providing care, because parents, the most important things that parents have are their newborns, so they can contribute with the care providers. So it's important to work together and advocate on that perspective.
Absolutely. We have a question from our live audience. Somebody's joining us from Buenos Aires. She asked, what can you tell about follow-up after an ICU discharge? There is a high disparity in follow-up programs within countries, actually even within a country, because here in Canada, we have a huge disparity. A family is born in a rural, remote area versus in the big centers. So health and education are scarcely linked so as to provide early childhood education. How can we encourage policies about these issues? This is from Lydia from Buenos Aires.
Thank you, Lydia. It's an important question, and I know that in Buenos Aires they have a great experience providing follow-up to preterm newborns, but I also know that we also know that it's not enough. So not only having specialized service providers, follow-up units, it's also about having national guidelines. And this is why we are working together with WHO and the Pan American Health Organization on developing these guidelines that we expect that will be translated into national guidelines that regulate having follow-up units in the different health services, and also at the community level, because you don't need high technology to provide follow-up to newborns. Having telemedicine, having the possibility of referral, it's enough. So we need all the experience from colleagues as Dr. Lydia and all the experts having the experience on that perspective.
Absolutely. Dr. Duran, unfortunately, our time is up, but I will bring you back because there's so many more questions and things to be addressed that we really need to work together and, hopefully better outcomes for babies born preterm, but also engage more families and really work on the equity piece, because this is so very important in every single country. So Dr. Duran, thank you so much for joining us today.